Now comes the real action. The rupture of endothelial cell. Any action, may be the cut or any damage to the tissue, will rupture the endothelial cell. Sometimes also some drugs and antibody antigen reactions, several reactions, temperature. There are many factors which can rupture the endothelial cell. The rupture of endothelial cell will flow the blood from vessel to outside. So we'll make the rupture here. Suppose this is the rupture of endothelial cell. Along with endothelial cell, the subendothelial cell and also some epithelial cell. If the rupture is from outside, epithelial cell will also be destroyed. So this is the ruptured or damaged endothelial cell. The first thing after the rupture of endothelial cell, like I said previously, there are several factors which keep the clotting factors inhibited, are present on or secreted by endothelial cell. After the rupture, those factors are also not present here, like nitric oxide, prostacyclin, and ADP inhibitors, all are gone from the site of rupture. Nitric oxide plays dual role. Nitric oxide, when present inside, it plays as inhibitor of platelet. After the rupture of endothelial cell, nitric oxide also comes out. This nitric oxide plays as vasoconstrictor. What it does, it constricts the blood vessel so that the blood flow will be reduced. Apart from this, there are some smooth muscle cells here. When the blood vessel is ruptured, these smooth muscle cells will also constrict the blood vessel, and neurons are also present here, which also sense the rupture cells, and they will initiate the constriction, blood vessel constriction. So the first thing happens after the rupture is constriction of blood vessel. Simultaneously, what happens? These rupture cells of these rupture endothelial cells will secrete one important factor, which is called VWF, von Willebrand factor. So this is very important factor. This is secreted from endothelial cell, and this von Willebrand factor is a multimeric protein. This will bind to collagen, and simultaneously these factors also bind to platelets. As I said, platelet have different receptors. This VWF will bind to collagen, VWF. These factors will also bind to, these are the multimeric proteins, these also bind to flowing. So there are platelets here because there is no nitric oxide and ADP inhibitor, and also there is no prostacyclin. That is why some of the receptors are active in platelet. So these platelets will bind to VWF. So which receptor binds to this VWF? GP1B. GP1B will bind to VWF, and after the binding of GP1B, the GP6 will also bind to the collagen. This is collagen. This will also bind to collagen. So this will make the binding stronger. After the binding, the platelet gets activated. So the activated platelet will change its shape. This will form like this. The platelet will change its form using its microtubule. Microtubules are helping after activation. They help in changing their shape, and they will release these granules and the inside material of these granules. Now we will see what are the components of these granules. So we will know what are the components are secreted from platelet. Now we know that they have two types of granules: alpha granule. What does alpha granules contain? Alpha granules contain factor 5. Like I said earlier, that all the factors which are important for clotting are secreted from liver. Apart from all the factors, some factor 5 and factor 8 are also present in platelets. Third, fibrinogen. Fibrinogen is also present in platelet. Fourth, platelet activating factors. Fifth, PF, platelet factor 4. This one is little important when it comes to the vaccine, like the AstraZeneca vaccine. And sixth, PDGF, platelet derived growth factor. We'll talk about what are the function of these factors. And what does delta granule or dense granule contains? Dense granule have mainly three things: S, A, C: serotonin, ADP, calcium. We'll talk about dense granule first. These platelet, after getting activated, they will secrete these granules. These serotonin are also vasoconstrictor. So they will make the vessel constrict to reduce the blood flow. And what ADP does? ADP, as I said earlier, ADP activates platelets. So this ADP secreted from the platelet, activated platelet, will further activate more platelets. So there are several platelets present in the blood. So they will activate those platelets. And we'll talk about what calcium does. Apart from this, they also secrete platelet activating factor, which also help in activation of other platelets. Platelet factor 4. What platelet factor 4 does? PF4. This will bind to heparin. This will bind to heparin so that antithrombin cannot bind to heparin. And antithrombin, because antithrombin cannot bind to heparin, this will not inhibit thrombin, and thrombin will be activated. Along with this, the activated platelet also secretes some thromboxane A2. This thromboxane A2 is made by cyclooxygenase 1, COX-1. Why this is important? Because there are some drugs like aspirin. Aspirin inhibits cyclooxygenase so that thromboxane A2 is not formed. So that is why this aspirin is used as blood thinner, because thromboxane is also secreted from platelet, activated platelet. This thromboxane will also activate platelets. What are the factors secreted from platelet? Now, serotonin is vasoconstrictor, platelet factor 4, platelet activating factor, ADP. These are the factors, and also thromboxane A2. These are the factors which recruit more platelets, and along with that there is another factor which is fibrinogen. Fibrinogen will bind to, after the activation of platelet, the fibrinogens bind to GP2B, glycoprotein 2B. Fibrinogens bind to this, and to this another platelet. This is GP2B. After the activation, these platelets also bind through GP2B to fibrinogen and other platelets. Like this, there will be several platelets clogged here. So this clot is called primary hemostatic clog, and this process is called primary hemostasis. And this primary clot is very loose. And what do we need here? We need fibrin filaments. So when the fibrins are present, this will become secondary clot.